Let's talk about the problems with PRP injections and give you some alternative options that are less expensive and generally more effective in the long run. So platelet-rich plasma, it's a regenerative medicine injection where your blood is drawn, the platelets are concentrated down, and that's injected into areas that have arthritis, degeneration, herniations, bulges, and tendinitis. So it's kind of a complex procedure, and with platelet-rich plasma, every procedure has a kit, right? So there's a kit where your blood is drawn into this kit and it's spun down in a centrifuge, but you're going to be limited into the amount of areas that can be treated because of the limitations of this kit. So most doctors will use a knee, for example, because bone on bone and arthritis in the knee is one of the most limiting things in the world, and it's the most common area where PRP is used. So most doctors are just going to take that platelet-rich plasma and go just straight into your joint, and that's it. You're going to get one injection, and hopefully that takes care of your problem. But in the vast majority of cases, it's not just the joint that causes our pain. What is most important is what we call the extra-articular structures, or all the stuff outside of your joint, right? And if you only have enough solution to go right into the joint, then you miss all these other things that can cause pain. So mainly these ligaments, these tendons, and all the nerves and muscles that surround your joint. And so what I like to use in my clinic is a combination of prolotherapy and ozone therapy. We call it Prolozone. It's an all-natural regenerative injection. It's as effective as PRP, but we're not limited to just a kit. We can treat all of the structures very comprehensively. So when you come in with arthritis or bone on bone or meniscal tears or some tendinitis in your knee, I'm not just treating that one area. We're going to comprehensively treat the whole joint so that it's more stable, so that it's not getting excessive wear and tear and laxity in these ligaments that stabilize your joint. We can treat all the sensory nerves that provide pain signals back up to our brain and help to calm those down. We can treat inside of the joint. We can treat all the muscles that help, again, to create stability and help your knee joint to move. So we can comprehensively treat this whole joint with Prolozone injections incredibly effectively and not miss any of the things that are generating your pain. So I find that Prolozone is just overall a more effective treatment modality. It's significantly less expensive than PRP too, so you get a couple added benefits. One, it's more effective. Two, it's less expensive. And three, we can be more comprehensive. So if you are dealing with bone-on-bone arthritis or degeneration in your knee, or you have some little tears that are causing you pain, then consider Prolozone injections. I have a clinic here in Tampa, Florida. I've treated hundreds and hundreds of knees incredibly successfully. Most patients need 3 to 6 visits. We space them out every couple weeks. And that really makes a huge difference in terms of their ability to go up and down stairs, get out of chairs, do all the things that they weren't able to do. You might need a booster once a year, once every 18 months or so after a comprehensive treatment plan like that, but it can really give you your quality of life back and help you to avoid surgical procedures that have no guarantee. So now you can make a better choice.